You know, Dr. Bush, I get messages every single day from women saying, I feel off, but my doctor says it's normal. And when I dig deeper, almost half of them are showing early signs of PCOS, and they didn't even know it.
Exactly, Dr. Sticks. Polycystic ovary syndrome is one of those silent disruptors. It sneaks in, changes your cycles, your mood, even your weight, and most women dismiss it as stress or just hormones.
And that's dangerous because ignoring it can lead to long-term issues, fertility problems, insulin resistance, even heart complications down the line. Today, let's break down the 10 signs of PCOS you absolutely shouldn't ignore before it becomes a bigger problem. Sign 1, irregular periods.
Let's start with the most obvious, irregular periods. But here's the thing, it's not just about missing 1 or 2 cycles.
Right, if your period is unpredictable, sometimes 2 weeks, sometimes 6, or you skip months altogether, your body is signaling hormonal imbalance. And for women with PCOS, that irregularity isn't occasional, it's consistent.
And even if it seems manageable with birth control, it's still masking the underlying problem.
Sign 2, unexplained weight gain. Number 2, weight gain you just can't shake, especially around the abdomen. Not the kind from binging on pizza. This is stubborn hormonal weight.
Exactly. PCOS affects insulin sensitivity. Your body holds on to fat, your metabolism slows, and suddenly the scale is rising no matter how strict your diet.
And what's frustrating is even intense workouts might not give results, leaving many feeling like they've failed, when it's really PCOS at play. Sign 3, excess hair growth.
Number 3, hirsutism, excess hair growth on the face, chest, or back.
Women come in saying, I'm suddenly sprouting chin hair or noticing thick hair along their abdomen. That's a hormonal red flag right there. High androgens, male hormones, are a hallmark of PCOS.
And it's not cosmetic alone. It signals the body is out of balance, which can affect ovulation and long-term health.
Sign 4, acne and oily skin. Number 4, persistent acne and oily skin. Not teen acne, but adult acne that just won't quit.
Exactly. When hormones are off, the skin reacts. Clogged pores, inflammation, breakouts along the jawline and chin. And here's the kicker. Topical creams only mask it. They don't fix the root cause.
Sign 5, hair thinning or hair loss.
Number 5 might surprise many. Hair thinning on the scalp.
Right, the opposite of hirsutism. PCOS can cause female pattern baldness. Women notice widening part lines, receding hairlines, or overall shedding.
It's confusing because people expect PCOS to only cause hair growth, but hormones can both stimulate and inhibit hair in different areas.
Sign 6, fatigue and low energy.
6 is fatigue, persistent daily exhaustion that coffee can't fix.
This is tied to insulin resistance and hormonal imbalance. Energy crashes, mood swings, and brain fog are often dismissed as busy life. But in women with PCOS, it's a core symptom. And ignoring it isn't just about feeling tired, it affects work, relationships, and mental health. Sign 7, difficulty losing weight even when exercising and dieting.
7, difficulty losing weight, even when exercising and dieting.
We've touched on weight gain, but losing it is a different battle. PCOS can make fat clinging to your body feel like cement. Standard calorie cutting might not work because of insulin and hormonal issues. Sign 8, mood swings and anxiety.
8, mood swings, anxiety, sometimes depression.
Many women experience emotional turbulence, from irritability to deep sadness. PCOS is not just physical, it's neurological. Hormones like progesterone, estrogen, and androgens influence neurotransmitters, affecting mood. And if untreated, it can spiral into chronic anxiety or depression. Sign 9, sleep problems or sleep apnea.
9, sleep issues, trouble falling asleep, staying asleep, or waking up exhausted.
PCOS increases risk for sleep apnea, especially in women with higher BMI. Poor sleep worsens insulin resistance and weight problems, a vicious cycle. And ignoring it might seem harmless, but over time it elevates risks for heart disease, diabetes, and mental health issues. Sign 10, fertility challenges.
Finally, number 10, difficulty conceiving.
PCOS is a leading cause of infertility. Irregular ovulation or anovulation can make it challenging to get pregnant. And even if you eventually conceive, untreated PCOS raises risks during pregnancy, gestational diabetes, hypertension, and complications. Early awareness changes everything. So there you have it, the 10 signs of PCOS you absolutely shouldn't ignore. If you see even a few of these in yourself or someone you care about, don't wait.
Early diagnosis allows lifestyle changes, medical interventions, and hormone management to prevent long-term complications.
PCOS isn't something you just live with, it's something you manage. And when you do it early, you regain control over your body, your health, and your life.
Remember, knowledge is power. Don't ignore the signals. Listen to your body.
And don't hesitate to consult a specialist. The sooner you act, the better your chances of thriving despite PCOS.
And don't hesitate to consult a specialist. The sooner you act, the better your chances of thriving despite PCOS.
You know, Dr. Six, I think we also need to address something that many women don't talk about openly: the guilt.
That's a powerful point. The guilt of thinking, maybe it's my fault. Maybe I didn't eat well enough. Maybe I didn't exercise enough.
Exactly, but PCOS is not a punishment. It's not laziness. It's not lack of discipline. It's a medical condition driven by hormonal imbalance and metabolic factors.
And that misunderstanding alone causes years of silent suffering. I've had patients who blame themselves for weight gain, irregular cycles, or infertility, when in reality, their body was fighting a biochemical battle.
Let's talk briefly about diagnosis, because some women think they can just Google their symptoms and self-diagnose.
That's risky. Proper diagnosis typically involves medical history, physical examination, hormone level tests, and sometimes an ultrasound to check ovarian structure.
And here's what's important. You don't need to have every single symptom to have PCOS. Even 2 major clinical criteria can lead to a diagnosis.
That's right. Some women have irregular periods and high androgens. Others may have ovarian cyst patterns and insulin resistance. It presents differently in different bodies.
And especially across different ethnic groups. For example, some African women may not present with obvious cysts, but may struggle more with insulin resistance and weight management.
Which is why personalized care matters. There is no one-size-fits-all solution.
Let's also discuss something hopeful: management.
I like that word, management, because while there is no instant magic cure, PCOS can absolutely be controlled.
Lifestyle plays a huge role. Balanced nutrition, strength training, managing stress levels, and prioritizing sleep can significantly improve symptoms.
And even modest weight reduction, as little as 5 to 10% of body weight, can improve ovulation patterns in many women with PCOS.
That small shift can restore menstrual regularity and improve fertility outcomes.
And medically, depending on the patient's goals, treatment options may include hormonal therapy, medications that improve insulin sensitivity, or fertility treatments when needed.
The key is early awareness. The longer PCOS remains unmanaged, the greater the risk of long-term complications like type 2 diabetes or cardiovascular issues.
I always tell patients, your body whispers before it screams.
That's powerful.
Irregular periods? That's a whisper. Stubborn weight gain? Another whisper. Mood instability? Another whisper.
And when you ignore whispers long enough, they become louder problems.
But the good news? The body also responds beautifully when supported correctly.
I've seen patients regain cycle consistency, improve skin clarity, stabilize mood, and even conceive after years of struggle simply because they finally understood what was happening.
Knowledge changes outcomes.
So if you're listening right now and you recognized yourself in even 3 of the signs we discussed, don't panic.
But don't ignore it either.
Get evaluated, ask questions, advocate for your health.
Because your hormones influence nearly every system in your body: metabolism, mood, skin, sleep, fertility.
And when those systems are supported, everything improves.
PCOS is common, but silent suffering doesn't have to be.
Early awareness is power.
And informed action is protection.
Listen to your body.
Respect the signs.
And never ignore what your health is trying to tell you.
Because when you understand your body, you take back control of your future.